Welcome to Pressure Injury and Prevention, Causes and Risk Factors, a Frontline Forces training module presented by Superior Health Quality Alliance. This learning module was developed with the nursing assistant in mind and created specifically for those working in nursing homes and long-term care. This course will provide an overview of pressure injuries and will build on your current knowledge. You, the nursing assistant, play a critical role in noticing small and subtle skin changes on residents in your care. Why? Because as a nursing assistant, you provide direct care for residents during each shift. You are often the first and last person to see the resident at shift changes. Superior Health aims to empower nursing assistants by increasing your confidence with making the right decisions, such as knowing when to tell someone what you see, and improving the ability to identify risks to prevent pressure injuries. The purpose of this course is to further your learning and application of these skills to real-life situations, and identify what you can do to improve quality and safety of resident care. This learning module, Pressure Injury and Prevention, is comprised of a three-part series. You are viewing the first in the series, Causes and Risk Factors, which provides an overview of the cost, impact, causes, and risk factors leading to the development of a pressure injury. This Pressure Injury and Prevention module offers two additional trainings in the series. Part 2 provides an overview of pressure injury staging, while the third installment in the series provides valuable interventions for pressure injury prevention. It's not necessary to complete the entire series in one sitting. You can exit and return to the course at any time. Let's review our learning objectives. After completing this training, nursing assistants will be able to explain the impact pressure injuries have on residents in nursing homes and across the nation. Define a pressure injury. Interpret the impact of pressure, friction, and shear on the development of a pressure injury. And finally, nursing assistants will examine factors that increase resident risk for developing a pressure injury. What is a pressure injury? While often referred to by other names such as pressure ulcers, decubitus ulcers, or bed sores, in 2016, the National Pressure Injury Advisory Panel changed the name from pressure ulcer to pressure injury, as the approved name provides a more accurate description. A pressure injury is defined as local damage to the skin, underlying soft tissue, or both, that usually occurs over a bony prominence such as heels, elbows, or the tailbone. 2.5 million patients are affected by a pressure injury every year in the United States. The cost of care is high, ranging anywhere from $20,000 to over $150,000 for treating each pressure injury. The total cost of care associated with pressure injuries in the United States alone is estimated between $9 billion to over $11 billion per year. Pressure injuries also have a significant impact on the lives of those with pressure injuries and their families. In addition to the high price tag for treatment, pressure injuries can cause severe pain, emotional suffering, and can increase the risk of death due to conditions such as cellulitis, an infection of the skin and connected soft tissues, bone and joint infections, causing damage to cartilage and tissue that can reduce the function of a joint or limb. Cancer cells can develop in wounds that don't heal and become long-term concerns. And although it is rare, skin ulcers can lead to sepsis. A person's body remaining in the same position for long periods of time increases pressure to vulnerable areas on the body. This is the primary cause of a pressure injury. Some examples of body parts where pressure injuries are most likely to develop include the back of the head, elbows, the tailbone, or heels. Injury can also be caused by pressure that medical devices place on the skin, including oxygen tubing, Velcro straps, splints, cervical collars or soft restraints, abdominal binders, or even face masks. Seams or wrinkles in clothing or bed sheets can also put a resident at increased risk for developing a pressure injury. There are other contributing factors that increase a person's risk to developing an injury. These factors include friction and shear force. Alone or in combination, these factors can put the skin and soft tissue at risk for developing a pressure injury. We will now review risk factors involved in pressure injury development, beginning with pressure, friction, and shear force. Pressure is a gravity force pushing down on a person's body. The constant pressure placed on any part of the body can decrease blood flow to tissues. Blood flow is important for delivering oxygen and other nutrients to tissues, and without these nutrients, skin and nearby tissue are at risk of injury and breakdown. When an injury begins to form due to pressure, it can appear as a change in color of intact skin, or it can develop into an open ulcer or sore in just a few hours. Individuals may or may not feel pain in the affected area, depending on the severity of the pressure injury. Friction is the force of rubbing two surfaces against one another. An example of friction occurs when a resident is repositioned in a bed or a chair, and the skin is dragged across the bed linens or padding. Unlike shear injury, a friction injury will be visible and may look like a scrape, bruise, cut, or a tear on the skin. Shear occurs when two surfaces move in opposite directions. Think of this as pulling the bones of the pelvis in one direction and the skin in the opposite direction. This can happen when the head of the bed is elevated and the resident begins to slide down. The skin is staying in place, but the body is moving. Shear injury is not readily seen at the skin level because these injuries happen beneath the skin. Friction and shear are two separate reasons pressure injuries can develop, yet they go hand in hand, often working together to cause tissue injury. One rarely occurs without the other. Incontinence can expose a resident to prolonged skin contact with moisture, causing skin damage and increasing the risk of pressure injury development. Nursing assistants provide valuable pressure injury prevention by helping residents with incontinence to keep their skin clean and dry, assisting them with pericare as needed after each episode of being incontinent of urine or feces in order to minimize the time their skin is exposed to moisture. Application of a moisture barrier cream may help to protect the skin for residents who are routinely incontinent and where skin breakdown is becoming a concern. There are many factors that affect the ability of soft tissue to tolerate pressure, friction, and shear. These include immobility, incontinence, decreased or lack of sensory perception so a person cannot feel the pain or discomfort. Additional factors include poor nutrition, dehydration, dry or fragile skin, and medical conditions such as diabetes or vascular disease that affect blood flow. These risk factors place older adults and others at a higher risk for developing pressure injuries. Let's consider the following case study to further understand how nursing assistants are instrumental in preventing pressure injury. After listening to the story, click on the survey link to answer questions on concepts and principles reviewed in this module. This story is about Julia. She has been a nursing assistant for 4 years at a skilled nursing home in her community. Julia remembers each person she has cared for and appreciates how caring for them has shaped her experiences to further her career in healthcare. Julia learned a lot about pressure injuries from Ms. Jones, who was transferred to the nursing home for continued care while recovering from surgery. Meet Ms. Jones, a 67-year-old woman who recently had hip replacement surgery. Before her surgery, she rarely followed her physician's advice. Miss Jones has diabetes and was placed on insulin a few years earlier. Her doctor advised her to follow a diet that could control her blood sugar, but after having no luck on her own, Miss Jones decided it was easier to eat the same way she had before and just manage her high blood sugar levels with insulin. Miss Jones was also counseled by her physician that she would benefit if she began exercising, quit smoking, and lowered the amount of stress in her life. Thinking to herself, "That won't be easy," Miss Jones nodded in agreement, but she was feeling helpless. She had tried and failed in the past and felt none of these things could work for her. Miss Jones decided, "I'm in full control of my life. I've been fine up until now, and I will continue the way I have been. And I'll let that doctor know when I need any of his advice." Little did Miss Jones realize she was not controlling risk factors that would impact her future health. After Miss Jones had the hip replacement surgery, she needed some assisted rehabilitation before going back home. When Miss Jones was ready for hospital discharge, she transferred to a skilled nursing facility until she was strong enough to transfer back to her home. After arriving at the skilled nursing facility and into Julia's care, Julia noticed Miss Jones had red areas on her elbows, and the skin on her tailbone and buttocks area looked dark red. The surface of the skin looked like it was scraped and was starting to wear away. Miss Jones' heels also looked dark and purple like they were bruised. Julia immediately told the nurse what she noticed about Miss Jones' skin. Julia returned to care for Miss Jones a few days later, and when she saw Miss Jones again, what she saw shocked her and upset her. Julia remembered being concerned for Miss Jones before leaving the past time she had cared for her. Julia knew Miss Jones had risk factors and understood how important it was to provide her the care she needed to recover. When Julia returned to the nursing home just a few days later, Miss Jones had extensive pressure injuries on her tailbone, buttocks, elbows, and heels. Julia knew there were obstacles that existed to provide Miss Jones the care she would need to fully recover. First, Miss Jones was a larger lady with limited mobility, which put her at risk of remaining in the same position for long periods of time, thus increasing the pressure to areas of her body. Julia knew it would be hard finding enough staff to properly turn and reposition her. Julia also knew severe pressure injuries causing damage to the skin and soft tissue could lead to other problems, including infection of the skin and underlying tissues, bone and joint infections, damage to cartilage, and could even result in more limitations to mobility of the joint and the limbs. And that didn't even include the physical pain. On top of the physical concerns, Julia was also aware of the effect these types of injuries could have on Ms. Jones' level of emotional stress, and how costly it would be due to the extensive treatment and care she would require for the bed sores for months to come. Now, as Miss Jones looked at Julia, she confided to her nursing assistant. She felt scared and confused. "What has happened to me? How did I get to this point?" Julia listened to Miss Jones' concerns, and then she thought back and wondered, how could this situation have been prevented? It's now time to test your knowledge.